I think it's really important to acknowledge the impact that eating disorders have on other areas of mental health. Eating disorders don't come in small boxes that are just diagnostically based on an eating disorder. Often we see that people are struggling with other parts of their mental health as well. And of course, this varies for different people. Um, in my work, we often see a comorbidity or overlap between some other sort of common mental health problems like depression, anxiety, and obsessive compulsive disorder. So the rates of depression often can be quite high, and having depression can have a negative impact on someone's functioning. When we're thinking about anxiety, someone with an eating disorder can present with having anxiety around eating certain foods, going to places where food might be served, having a fear of weight gain. With obsessive compulsive disorder, we see some similarities with eating disorders in terms of thinking patterns. So sometimes there can be a focus or a preoccupation on certain thought patterns, and also on maybe some repetitive behaviors. We also often see perfectionism traits in eating disorders. And I think for me, what's really important is how we understand all these factors and how they impact and are interlinked to someone's eating disorder. So, in that way, it's the importance of actually viewing someone with an eating disorder in a much more holistic way.